Do you have knee pain but have no idea what's actually causing it? Maybe it hurts in the front, on the side, or deep inside the joint. And nobody has ever explained to you why. Where your knee hurts is not random. It's a clue. And today I'm going to help you read that clue. Knee pain is one of the most common complaints I see. And the frustrating thing for most people is not the pain itself. It's not knowing what's causing it. They get taught to rest, take some medication, and wait. But without understanding what's actually happening inside the knee, most people either stop moving completely or keep doing the exact thing that's making it worse. Today that changes. My name is Jan Sosnowski. I'm a physiotherapist working in Dubai, and I help people with knee pain understand what's going on in their body and get back to moving without pain. I've worked with many patients who came to me with chronic knee pain. Some had it for months, some for years. In most cases, a specific and targeted exercise plan eliminated their pain and they returned to normal life. Movement is the best doctor. I'm going to walk you through the most common knee pain diagnoses, organized by where you feel the pain. You will learn what structure is involved, what's causing the problem, and what you can do about it. But before we start, there is some important information you need to know. Your knee is not a simple joint. Running through it and around it are bones, cartilage, tendons, ligaments, and fluid-filled sacs, all working together every time you walk, climb stairs, or standing up from a chair. When something goes wrong with any one of those structures, you feel it. But here is what most people don't realize. The location of your pain almost always points directly to which structure is involved. Pain at the front of the knee means something different to pain on the inside. Pain below the kneecap means something different to pain behind it. Once you know what you are dealing with, you can stop guessing and start fixing it. I've had many patients walk into the clinic convinced their knee was beyond help. They'd stop exercising, stop going for walks, stop doing things they loved, because nobody had taught them what was actually wrong. Once they understood the cause, and once we gave the knee the right kind of movement, the pain reduced. They came back to normal life. That's what understanding your knee can do for you. Pain at the front of the knee. The front of the knee is the most common area for pain. The main structure here is called the kneecap, medically known as a patellar, which sits in a small track at the end of the thigh bone and glides up and down every time you bend and straighten your leg. Patellofemoral pain syndrome, runner's knee. If you feel a dull ache around or behind the kneecap, pain that is hard to pinpoint, you can't just point to it with one finger, especially when going downstairs, squatting, running, kneeling, or sitting for a long time. This is likely patellofemoral pain syndrome, which most people know as a runner's knee. You don't have to be a runner to have it. Here's what's happening. The muscles that attach to your kneecap, mainly the large muscles at the front of your thigh, can become unbalanced or weak. When that happens, the kneecap doesn't glide smoothly up and down in its track. Instead, it tilts, pulls to one side, and creates pressure on the structures underneath. That pressure is what you feel as pain. A key sign that this is runner's knee rather than something else is how it started. After starting a new exercise routine, increasing how much you walk, or returning to activity after a break. The pain tends to feel deep and spread out behind the kneecap. You cannot press one finger on the exact sore spot. It is the whole area that aches. Going downstairs is often worse than going up because the kneecap is pressed harder into its track during that movement. Sitting for long periods can also cause an aching pain because the kneecap rests under pressure against the thigh bone. This is sometimes called the movie theater sign. You've been sitting fine, and the moment you stand up, the front of your knee aches. You usually don't need an X-ray or an MRI. The main treatment is exercise, specifically strengthening the muscles around the knee and the hip. You don't need to stop moving. Appropriate movement is exactly what helps. Patellofemoral arthritis. Patellofemoral arthritis can feel similar to runner's knee on the surface. Pain around or behind the kneecap with stairs, squatting, or prolonged sitting. But there are important differences that help tell them apart. Runner's knee tends to come on relatively quickly in response to a change in activity. Patellofemoral arthritis is a long-term wear and tear condition that builds up slowly over many years. The cartilage on the back of the kneecap gradually wears down, and the joint loses some of its smooth surface. The key difference you will notice is morning stiffness. With patellofemoral arthritis, the knee often feels noticeably stiff and slow to get going first thing in the morning or after any period of rest. You may also notice a grinding or grating sensation as the knee moves. That is the surfaces of the joint moving against each other with less cushioning than before. The treatment approach is the same. Exercise, strengthening, and keeping the joint moving within a comfortable range. Movement helps keep the joint healthy and reduces pain over time. Prepatellar bursitis. If the front of your knee is visibly swollen, not just painful but actually puffy and rounded, you may have prepatellar bursitis. A bursa is a small fluid-filled sac that sits between tissues to reduce friction. The prepatellar bursa sits directly in front of the kneecap, just under the skin. When it becomes inflamed, usually from kneeling repeatedly on hard surfaces without padding, it swells up and becomes tender to touch. Icing the area and avoiding kneeling usually settles it down. If the area becomes red, hot, or swelling is significant, see a doctor to rule out infection. Quadriceps tendinopathy. Just above the kneecap, the quadriceps tendon connects the large thigh muscles to the top of the kneecap. Pain here can feel similar to runner's knee at first. It comes on with squatting, stairs, and activity around the front of the knee. But there is a simple way to tell them apart. With runner's knee, the pain is deep and spread out. You cannot find one specific sore spot. With quadriceps tendinopathy, the pain is very specific. Press your finger right onto the thick tendon just above the top edge of the kneecap. If you find an exact sore spot right there, that is the tendon, and that is your problem. This condition means the tendon is overloaded. It usually happens when someone does too much too soon. A sudden increase in exercise, more stairs than usual, or returning to activity after a period of rest. The treatment is not complete rest. Rest weakens the tendon further. The treatment is a gradual loading program. Exercises that slowly and progressively challenge the tendon so it can rebuild its strength and tolerance. Patellar tendinopathy. Jumper's knee. Just below the kneecap, the patellar tendon connects the bottom of the kneecap to the shin bone. Pain here, directly below the kneecap, especially with jumping, running, or fully bending and straightening the knee, is called patellar tendinopathy, commonly known as jumper's knee. Just like with the tendon above the kneecap, you can press your finger right onto the tendon just below the bottom edge of the kneecap. If that is the exact sore spot, this is your diagnosis. The cause and treatment are the same as quadriceps tendinopathy. Overload, usually from doing too much too soon. A gradual loading program is the primary treatment. You don't need an X-ray for this. You need exercise. Hoffa's syndrome, fat pad impingement. Just behind the patellar tendon sits a cushion of fatty tissue called the infrapatellar fat pad. Think of it as a natural shock absorber inside the front of the knee. When it gets irritated or squeezed from a fall, direct knock, or repeatedly straightening the knee forcefully, it becomes inflamed and painful. This is called Hoffa's syndrome or fat pad impingement. You will typically feel pain on either side of the patellar tendon, especially when you fully straighten your leg or stand for long periods. The main treatment is to temporarily reduce the activities that aggravate it and allow the inflammation to settle before gradually returning to movement. Osgood-Schlatter disease. If you are a parent watching this, or if you experienced this as a teenager, Osgood-Schlatter disease causes a painful, hard lump just below the kneecap, where the patellar tendon meets the shin bone. It is most common in young people who are growing very fast and who are also playing a lot of sport involving running and jumping. During rapid growth, the bone at that attachment point can become irritated and inflamed. It is not dangerous, and most young people grow out of it completely, reducing the amount of high-impact activity during flare-ups and using ice for pain relief are the most effective short-term strategies. Pain on the inside of the knee. Medial collateral ligament sprain, MCL sprain. Running along the inside of the knee is the medial collateral ligament. MCL is simply the short name for it. It is a flat, strong band of tissue that connects the thigh bone to the shin bone and stops the knee from collapsing inward. If you feel pain on the inside of the knee following an injury, a sudden twist, a fall, or an impact from the outside, the MCL is a likely cause. You may also notice some instability as if the knee wants to give way. Most MCL injuries heal well without surgery because this ligament has a strong natural ability to repair itself. The right rehabilitation makes a significant difference to recovery time. Medial meniscus tear. The meniscus is a C-shaped piece of cartilage that sits inside the joint and acts as a shock absorber between the thigh bone and the shin bone. There are two, one on the inside, one on the outside of the knee. If the inner one is damaged, you will typically feel pain along the inside of the knee in the gap between the two bones when the knee is slightly bent. A key sign of meniscus problem is catching or locking. The knee feels like it gets briefly stuck during movement, particularly going up and downstairs. If your knee locks and then releases, that is worth getting properly assessed. Meniscus tears that develop gradually with age, rather than from a sudden injury, are very common. Research shows these often respond just as well to exercise and rehabilitation as they do to surgery. Pace answering bursitis. A few centimeters below the inner side of the knee is a small fluid-filled sac, a bursa, that sits beneath the point where three muscle tendons all meet on the shin bone. When this sac becomes inflamed, usually from overuse or muscle imbalance, you feel pain in that specific spot, often during or after exercise. Ice can help calm the inflammation. Exercise targeting the surrounding muscles is the long-term solution. Pain on the outside of the knee. IT band syndrome. The iliotibial band, most people know it as the IT band, is a thick band of tissue that runs from the pelvis down the outside of the thigh and attaches near the outside of the knee. When it becomes irritated, usually from a sudden increase in running or cycling, you feel pain on the outer side of the knee that gets worse with activity and can sometimes travel up into the outer thigh. Even though many people believe the cause is usually not that the IT band is simply too tight. The main driver is a sharp jump in training load, doing too much too soon. Easing back on the aggravating activity, building strength in the hip muscles, and gradually returning to full load is the most effective approach. Lateral collateral ligament sprain, LCL sprain. On the outside of the knee is the lateral collateral ligament. LCL is the short name for it. It mirrors the MCL on the other side and helps keep the knee stable against forces pushing it from the inside. An LCL injury is less common than an MCL injury. It usually happens from a direct blow to the inner side of the knee or from a sudden twisting movement during sport. Pain is felt on the outer side of the knee and there may be a feeling of instability. Most LCL injuries are managed without surgery, with rehabilitation focused on rebuilding strength and stability. Lateral meniscus tear. The outer meniscus can also be torn, causing pain along the outer side of the knee. Symptoms are similar to an inner meniscus tear: clicking, catching, pain with twisting, or deep bending. Proper assessment helps determine the best course of action. Tibiofibular joint irritation. Below the outer joint line, towards the outside of the knee, is a small secondary joint where the smaller bone on the outside of the lower leg meets the shin bone. This joint can become inflamed or stiff from kneeling, sitting with legs crossed, or repetitive activity. You will feel pain on that small bony bump on the outer side of the knee, just below the main joint line. Gently moving the joint back and forth can help. If it's too sore to do that, ice the area first. Common peroneal nerve irritation. Wrapping around that same bony bump on the outside of the knee is a nerve called the common peroneal nerve. When this nerve gets compressed or irritated from prolonged pressure, kneeling for a long time, repeatedly crossing the legs, or a direct injury, it can cause pain, numbness, tingling, or weakness that travels down into the foot and lower leg. This is different to joint pain. If you have those symptoms alongside your knee pain, mention it specifically when you see a physiotherapist or doctor. Pain around the entire knee. Osteoarthritis. Osteoarthritis is often described as wear and tear of the cartilage inside the knee. Unlike most of the conditions we have covered so far, which tend to cause pain in one specific spot, osteoarthritis can cause pain almost anywhere in and around the joint. However, it is important to know that osteoarthritis does not always hurt the whole knee equally. In many people, the wear is concentrated on just one side, either the inner side or the outer side of the knee, depending on how that person walks and how they carry their weight through the joint. So if your pain is mostly on the inside of your knee and your doctor has told you it is arthritis, that is why. The wear is greater on that side. Common signs include stiffness that is noticeably worse first thing in the morning or after sitting for a while, swelling, a reduced range of movement, and sometimes a grinding or grating feeling as the knee moves. Here is something important. Many people are told they have osteoarthritis and take that as a reason to stop exercising. This is one of the most damaging misconceptions about knee health. Exercise does not wear the joint out faster. Regular, appropriate movement is one of the most effective treatments for osteoarthritis. It reduces pain, builds strength in the muscles that support the joint, and in many cases, delays or removes the need surgery entirely. If you have been told you have arthritis and you have stopped moving, start again. Gently, gradually, consistently. Pain deep inside the joint. The ligaments. ACL and PCL injuries. Inside the knee, crossing each other in the center of the joint, are two ligaments: the anterior cruciate ligament and the posterior cruciate ligament. Most people have heard of the ACL. The PCL is its lesser known partner. These ligaments are deep inside the joint. You cannot feel them from the outside. ACL injuries most commonly happen during sport: a sudden stop, a twist, or a landing from a jump. People often describe hearing or feeling pop, followed by rapid swelling and a strong feeling of instability. The knee feels like you can't trust it. Whether surgery is needed depends on a number of factors: your age, what you want to get back to doing, and how stable the knee feels. What is always needed, regardless of whether surgery happens or not, is rehabilitation. Exercise before and after any treatment is essential. If you have sudden, significant swelling in the knee following an injury, see a doctor. Do not wait. Pain behind the knee. Baker's cyst. Popliteal cyst. A Baker's cyst, the medical term is popliteal cyst, is a build-up of fluid at the back of the knee that forms a lump you can often feel or see. It usually develops as a result of another underlying problem, osteoarthritis or a meniscus tear, that causes excess fluid inside the joint. That fluid gets pushed to the back and collects there. A Baker's cyst by itself is not always painful. Treating the underlying cause, not the cyst itself, is the priority. Popliteus muscle strain. The popliteus is a small, deep muscle at the back of the knee. It plays an important role in how the knee bends and rotates. It is sometimes called the key to the knee because it is responsible for unlocking the knee from a fully straightened position so that bending can begin. When it is strained or overworked, often from walking downhill, running or skiing, you feel pain deep in the back of the knee, slightly to the outside. Reducing the activities that aggravate it and following a targeted rehabilitation program are the main treatments. Hamstring strain or tear. The hamstring muscles run down the back of the thigh and their tendons attach around the back of the knee on both sides. A strain or partial tear of these tendons cause pain at the back of the knee, particularly with bending movements, walking uphill, cycling, or exercises that load the back of the thigh. If the injury is severe, a complete rupture, you may notice a gap or a lump in the muscle, and you should see a doctor straight away. For strains and gradual tendon problems, a progressive loading program is the most effective treatment. What to do about knee pain? Regardless of which diagnosis applies to you, there are 3 things that apply to almost every knee pain situation. First, modify, don't stop. If a specific activity is causing a flare-up, reduce it temporarily, but do not stop moving entirely. Complete rest weakens the muscles that support your knee, and that makes everything worse. Think of it as taking 1 step back so you can take 2 steps forward. Second, strengthen. The muscles around the knee, the large muscles at the front of your thigh, the muscles at the back, and your glutes are what protect the joint. When those muscles are weak, the joint takes more load than it should. Targeted strengthening exercises are the single most effective long-term treatment for almost all knee problems. Third, be patient. Knee pain rarely disappears in a week. Tendons, cartilage, and ligaments take time to heal and adapt. Consistent, appropriate movement over weeks and months is what produces lasting change. If your pain is severe, came on suddenly after an injury, is associated with significant swelling or locking, or is not improving, see a physiotherapist or doctor for a proper assessment. If this video helped you understand your knee pain better, subscribe and let me know in the comments what you'd like me to cover next. I read every comment and it helps me make the right videos for you. Knee pain is a signal to change something, not a reason to stop living your life. Movement is the best doctor. You just need to know where to start.